Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today's topic has to do with measles, re-emergence, and vaccine efficacy. In the developed world, you hardly hear of measles re-emergence. Why? Because they still do not stop. They didn't stop the immunization of measles vaccine. But you find this a problem in developing countries because in the developing countries, the financial empowerment is not there to really give the public health the necessary financial resources and support. But why do we have to suffer that much? It is a problem that I am trying to look at in this video, that what can we do to even help ourselves to alleviate this serious re-emergence of measles. Measles has serious complications, especially when not treated. And what more can we do in developing countries to help and stop this re-emergence of measles serious devastation? So, as usual, click on the like button, subscribe, and let's move on into the slide session for more detailed explanation. The outline: objective, introduction, present situation, lab diagnosis, prevention, and recommendations are all that I shall be talking about here. The objective: to expose the reasons for measles re-emergence and what needed to be done to prevent its escalation from a medical laboratory scientist perspective. Introduction: measles is highly contagious and spread rapidly in an overcrowded area. But the measles vaccine, probably the world's population would have been half by now, because there was hardly any child before the age of 15 years that had not experienced it in 1912 to 1963, which shows how efficacious it is, highly effective, with on average 400 to 500 deaths annually, according to WHO. It was a leading cause of death amongst children. And when you look at this virus diagram, you can see the magglutinins and the other structures, the envelope that contains the F fusion protein, as well as the M protein, that aids cell-to-cell spread of measles virus quickly, forming diagnostic giant cells. WHO report shows measles vaccination avert more than 60 million deaths between 2000 and 2023. In order for us to understand more the reason for measles re-emergence, let us look at this historical fact. In 2018 to 2019, even before the pandemic, the world experienced major outbreak of measles, with 140,000 reported deaths, mostly in low-income countries, where children suffer from malnutrition and overcrowding in areas recovering from natural disaster and conflict areas, and most children remain unvaccinated. Outbreak occurs. We find the outbreaks occurring in all these areas. So it is safe to say that malnutrition, especially lack of vitamin A, which has been found to prevent infant mortality, and overcrowding are the reasons for this re-emergence. Yeah, let's look at the present situation, because when we talk of re-emergence, let us now correlate it with the WHO finding. According to Kato Brain, a director in charge of vaccination at WHO, the alarming rise in measles cases is a stark reminder of results when immunization networks are weakened. Once considered on the path to elimination in many regions, measles is resurging due to gap in vaccine coverage. This increase is a warning signal that vaccination systems are at risk. Delayed campaigns before going out to vaccinate the children, supply chains disruption, and weakened trust in health services
have created the basis for outbreak. Our recommendation, however, remains enhancing surveillance, ensuring robust stockpile of vaccine, training health workers, assuring data systems are in place to drive impacts, and intensifying essential immunization services. A failure to act decisively now could see other vaccine-preventable diseases following the same dangerous trend. That warning is serious because we could experience the resurgence of other viruses. In 2023, measles cases rose by 20% worldwide compared to 2022, increasing from 8.6 million to 10.3 million, and also from 36 to 57 countries during the same period. Outbreaks occurred in all regions except in the Americas. These are just to show the present situation of measles resurgence. Laboratory diagnosis. The role of the laboratory cannot be overemphasized because no matter what, without the diagnosis, you will still not be able to really measure whether there is a re-emergence or just a guesswork. But the only way you can really say that, yes, measles has re-emerged is through the laboratory confirmatory test. WHO is strengthening the global measles and rubella laboratory network to facilitate timely diagnosis and tracking of measles outbreak and to support vaccination efforts. Vitamin A estimation, I suppose, could also be recommended since it has been confirmed to reduce morbidity and mortality, apart from ensuring sanitation, reduce overcrowding. More tests could be done for adults. ELISA tests, molecular tests, PCR, and others tests that could be done. Even in adults, you could collect the pharyngeal swab, as you could also do for children, but one must be very careful not to cause more harm to these children. Finally, the recommendation. What we can do to prevent the spread from a medical laboratory scientist standpoint is what I shall be talking more about, as well as other additionals. What we need to do is to perform a laboratory test to confirm it, just like I said, under the laboratory diagnosis, because delay is dangerous in order to contain it and identify the intense patient in any outbreak. It is unwise to depend only on clinical examination because the signs and symptoms are similar for many febrile illnesses. You could look at this chart that shows the rashes, and it's almost similar even with some viral infection, even with malaria, anything, yellow, just name it, virus, infection, febrile sickness. These days, there are many ELISAs and molecular tests that could be done to confirm it, though the gold standard remains cultivating the measles virus in monkey kidney and other susceptible tissue cultures. Prevention could be taking balanced diet, WASH, that is the acronym for water, washing of hands, and sanitation, and personal hygiene, including oral hygiene. No overcrowding. The CDC recommends that children get 1 dose of MMRV vaccine at 12 to 15 months of age, and the second dose at 4 to 6 years of age. MMRV is the acronym for measles, mumps, rubella virus vaccine, and like I mentioned, is very necessary if you want to stem the tide or end the spread of all these viruses. If you like what you have listened to, please click on the like button, subscribe. More videos are there for you to watch. Over 171, still counting. Just a little bit after 2 years of experience.